a lot of people are thinking there's great opportunities coming out of Ayushman Bharat. I have my own doubts. I don't want to be pessimistic because the same scheme, Ayushman Bharat has two components. Because I come from a medical background, I can understand. One is a traditional tertiary care, which they'll recognize hundreds and thousands of hospitals in the country. The same example is there in Andhra Pradesh and Telangana for the last 10 years, called the Arogya Shri scheme. And also the same scheme is available in Karnataka. Administrative Staff College of India did some analysis, research papers on that. So I'm sure all of you can dig into it, how useful is that. The second component of Ayushman Bharat, which is far more challenging to implement, is the so-called wellness centers, 100,000 centers. Technology can enable that, but will the government being as it is depend upon political influences, for them tertiary care is important. They want to bring a patient to a tertiary care hospital, and then obviously it's a vote-catching mechanism. But primary care is not so sexy. So if the government has the intentions, if they can make the primary care part of it better, there'll be tremendous opportunities for startups in that space. But the traditional inpatient facility, if that is the main intention of the government, I have my doubts whether it can really benefit. Anyhow, coming back to this topic, technology in healthcare, we'll not talk about the e-commerce, the teleconsultations, the appointment bookings, the e-consultations. Everything has been covered in the previous session. The previous speaker also talked about the data analytics. Rizwan, very enlightening presentation on that, because in Indian situation, if the data is not captured longitudinally over a period of time, especially the inpatient data, the real insights which come out of it will be less. But having said that, I think we'll limit ourselves to the real deep tech in healthcare. When I say real deep tech is using AI, machine learning, bots, all these in healthcare. I will ask Sandeep and Dr. Sharif to comment on that. Before that, I'll give two examples. One is our own portfolio company using AI in medical diagnostics, in clinical hematology, peripheral blood smear, urine examination, semen examination. They have both the hardware to capture the images and the algorithms to spit out the diagnosis. The second one, which I want every person in this audience, that's the kind of innovation we expect. It's not an Indian company, a company called Butterfly IQ, an ultrasound machine for less than $2,000. Normally, ultrasound machines sell for almost like 10 lakhs to 50 lakh rupees. Basically, this ultrasound machine is just the probe. Innovation in semiconductors. You basically attach to your iPhone, all the images go onto the cloud. And on the cloud, the algorithms will run. And finally, probably, it's too early to say, but 1 year down the line or 2 years down the line, they should be able to give diagnosis, whether it's a gynecology or cardiovascular, everything. So entire thing, unlike a traditional ultrasound machine, you need a separate machine for ultrasound, you need a separate machine for a cardiac. In the cardiac, you need a pediatric probe is different, adult probe is different, peripheral vascular probe is different. All of this has been condensed into one single probe. That's the kind of innovation we need in contrast to the platforms or all the e-commerce technologies. I think with this brief introduction, it's quite long introduction, I'll request Sandeep and Dr. Sharif to introduce themselves and in their expertise or experience, what are some one or two examples to just enlighten all of you, and so that you can go home and think on those, so that you can work on that kind of real breakthrough technologies which will impact patient healthcare and as well as your own lives. Thank you.
Thank you, Dr. Ramesh. So, quick introduction of myself. I'm part of 8 Roads, which is the proprietary investment arm of Fidelity International. Our journey, very interestingly, I think the two sectors where Fidelity in general and 8 Roads in particular have been very, very active are technology and healthcare. And the topic here is at the convergence of those two. So our journey has begun in 1969. We are not a typical venture capital fund. We are a single LP, patient capital. Very few, people are sort of aware of our private side of, investing pedigree as much as the public side. It began somewhere in the 1970s. We've backed some of the iconic companies like, Atari, which many of you might be familiar with, or more recently, or rather not so recently, Alibaba on the technology side, and several biotechnology companies, on the healthcare side. So as I think about, the topic, which is deep tech in healthcare, I think there are two lenses, at least from our perspective, because we work globally and we, like to think of ourselves as, a very integrated, investment franchise. We see very different things happening in India and outside. And I'll take two countries, or rather three countries as examples. If you think of US, I think the problem that they are trying to solve through deep tech is very, very different. I think they are focused on cost reduction. And they're already at a point where access is no longer as much of a problem as cost reduction. So one of our portfolio companies, for example, it's called Bui, is what is a symptom checker and is a new age WebMD, but which interacts with the patient. So if any of you have time to check it out, you go to Bui, and then, there will be a bot which will start talking to you, and you can interact. And depending upon the information that you feed to Bui, it will help you self-manage your condition. So it's there was WebMD, then there was WebMD for mobile, and now this is, the newest stage where it's your personal automated health assistant. So that's what, for example, is happening in the US. If I think about, similarly in UK, we backed a company which, is the NHS's partner, for digital triage, which is again, machine learning based, where the algorithms get refined as more and more patients use, and it helps you triage so that, the GP's time is more limited. So that's the, developed market point of view on, what, machine learning and AI is used for. If I look at India, however, closer home, and we've looked at it quite closely as we've struggled to find, deep tech, so-called deep tech digital health opportunities. I think the problem is that, we don't have data. I think when you have data to train machines and, start artificial intelligence, then you are at a very different stage of, evolution. I think our issue is that none of the hospital chains, and I've worked with plenty in some capacity or the other, even have integrated patient data across their different locations. On the outpatient side, we have no digitized prescriptions. So it's almost impossible to think of, machine learning and artificial intelligence in the context where, you probably do not have clean, consistent, integrated, temporal, data. And therefore, when we think of India, at least, my philosophy is that we have to solve, the problem at a much more basic level. And, therefore, so far, the couple of bets that we've taken in India are, people who've sort of taken one segment, of the outpatient journey. One of them deals with, diagnostics. The other one right now is focused more on pharmacy. But what we see is all of it coming together for somebody to actually integrate, at least on the outpatient side, patients' data across their outpatient journey, whether it is consultation, whether it is diagnostics or pharmacy, and make basic sense of it. Even that, I think, is going to be a great enabler. As you know, India is, one of the countries which has practically zero outpatient insurance. I think that's an opportunity waiting to explode. And while inpatient is still, with Ayushman Bharat, I think our inpatient coverage will go beyond 50%. I think outpatient continues to be completely undercovered. So our aspiration when we think of India is, for somebody to sort of, just provide, basic continuous data, analyze it very simply to enable, a digital platform for outpatient insurance. And that's what, for example, is our aspiration at, a company we backed very recently, which is PharmEasy. We've spoken about online pharmacies all day today in several sessions. But, when we look at PharmEasy, we don't think of it as, just an online pharmacy. We think of it as starting out with the 60% of where a patient's outpatient interaction and expenditure is, and then extending that to diagnostics or consultations, and eventually become a platform for outpatient insurance.
Thanks, Sandeep.
Hi, good afternoon, everyone. Just very briefly, my name is Sharif Sahadula. I'm the CEO of the KIMS Group. But first of all, I'm an internal medicine doctor. I practiced for the last 26 years in the U.S., led hospital systems there and healthcare management companies prior to moving to the Middle East and taking over as the CEO of the KIMS Group. I just want to make a comment. One of the panelists, I think it was panel 4, made a comment about usage of technology and doctors being the sort of the obstacle or stumbling block to using technology. And so I'll just come to defense of doctors in the room. There are certain on-the-ground realities, I think, that we have to come to grip with. One, I think Sandeep mentioned, is that most hospitals have HIS systems, the EMRs, and so forth, but to a large degree, they don't work very well. They don't. The compliance, doctors' compliance is not very high because they don't work very well. And so it becomes very frustrating for the doctor. You have the doctor in a room seeing an outpatient. He has to enter and type into the computer while talking to the patient. At the same time, you have someone saying to the doctor, make sure you speak to the patient and improve patient satisfaction. At the same time, you have someone presenting another piece of paper to the doctor saying, you need to replicate whatever you've put on the EMR in this insurance note so we can submit it for insurance claim. So, right now, the doctor's time, and the doctor being your driver in a healthcare system for revenue generation, is not optimally utilized. So I look at technologies that can really optimize physician utilization and increase their productivity. 15 years ago, when I used to go into my hospital, I used to print out a list of my patients, and at least from the computer I could print out a list of my patients. But I would go somewhere and get vitals from somewhere else, get their medication list from another place, try to find the chart, which was a physical chart. And, that was my workflow from hell. And, that piece of paper was my to-do list. And that was my, in a sense, my AI, and not artificial intelligence, but my alternate intelligence. And if I lost that piece of paper, I would be in real trouble. Nowadays, I go into the hospital, I get everything that I need on my device. I get the patient list, the patient vitals, I can do my insurance claims, I can do my insurance billing, and I have a virtual assistant with me. So if there's a patient that calls and I need to address an outpatient as opposed to an inpatient, I can make a mental note, I can write a prescription electronically. It can be sent electronically to a pharmacy rather than me having to write on paper and have someone fax it to the pharmacy. So these virtual assistants, at least from a doctor's perspective, have really better improved my work life and as a result have given me better time to spend with patients.
We can do a couple of things. Maybe I can ask some questions, or we can ask the audience to ask some questions, and if there's none from their side, I can ask you. Because we have only 9 minutes, because some of us have to catch the flights. Do any one of you want to ask some questions, because they come from a tremendous experience in investments as well as healthcare, practitioner. Yeah. Be specific, yeah.
Hello. Yeah, I'm Arun Mantena from Maranka. My question related to healthcare technology is how feasible is it to monetize data from AI or inpatient data or operation theater in India especially? And have you seen these instances of monetization elsewhere globally?
Sandeep, as I'm sure you'll say no.
It's not very feasible to monetize data in India, at least at present. I think globally also it's not a big, I think globally, digital health is, as I said, in the developed markets, it's all about cost savings and it's payer driven. Therefore, it is easier to monetize. In the US, I think payers are willing to pay. In the UK, NHS is willing to pay. It's a percentage of cost savings. But even there, if you look at a Teladoc, it's hardly it's I think a $70 to $100 million revenue company. For US, it's nothing. So in India, it's difficult. In short, I don't think the aim or the aspiration in India, at least in the near term, is from a data perspective monetization. I think the aspiration is, to be able to get and analyze data to produce the kind of insights which will make you strategically very valuable in the near term, and in the medium to long term, hopefully create very lateral monetization opportunities. I think there is enough amount of money that a pharma company is willing to spend today, for insights. It will not happen tomorrow, but out of the 120,000 crore pharmaceutical industry, about 30 to 40% is spent on marketing, which is ironical in a country like India, where 95% of drugs are off patent. So there is a lot of spend there. I think all big hospitals are willing to spend a reasonable amount of money to get business intelligence and increase compliance for patients. So again, just to give you a data point, most hospitals end up paying 10 to anywhere up to 20-25% of their surgical procedures in some manner or the other to the referring physicians. So you look at the healthcare delivery market and do a back of the envelope to see the amount of end opportunity there is. But I wouldn't sort of at all be unrealistic about it and say that you can start monetizing at least in the near term.
Any more questions? Yeah, please.
Hi, I'm Mohammed Sheikh from Smart Business Broker. I had actually two questions. One would be, in your opinion, especially for Dr. Sharif, who's familiar with the US model, what would be, let's say, the top 4 obstacles to having a PBM, a pharmacy benefits manager, gain traction in India? And secondly, for both the doctors on the panel, what would be the practical obstacles, like let's say the top 3 or top 4 practical obstacles to go ahead and incorporate electronic prescriptions in the Indian marketplace? Thank you.
I think the second question was already answered in the previous session. We'll not comment on that because the focus of this. Yeah, Sharif.
So, sorry, I didn't quite hear the first part of the question.
Pharmacy benefits.
What would be, let's say, the top 4 obstacles to having a pharmacy benefits manager gain traction in the Indian marketplace? So,
in terms of pharmacy and pharmaceuticals, there's tremendous benefit that we've seen with, you mentioned electronic prescriptions, but there's a lot of cost reductions that can occur with pharmacy managing programs. And one of the great challenges that we face in the U.S. is drug costs. And we've seen a tremendous reduction in costs using pharmacy type of programs. And it's looking at controlling medications. Other areas is using data to look at antibiotic and antibiotic resistance and controlling how we do prescriptions. I'm not sure if I quite answered your question. I'd just like to, I know that we don't have much time left, and I'd just like to make an additional point with regards to data. There's a lot of data in healthcare, and with that data, we can do a lot of risk stratification, we can do a lot of predictive analysis. But there's also dangers to having data. One of the earlier panelists talked about mental health. And in mental health, there are programs that have found to be very good, either chatbots or using natural language processing in diagnosing and predicting psychosis or mental illness. And it's even gone to the extent that pictures that you post on Instagram or Facebook, they have a high predictability of whether you have depression or get psychosis. So, which is good because there's a significant stigma with mental health and accessing mental health. The challenge and the danger of that also, and having that kind of data or predictive capabilities is, can that be used against an individual? And so what I mean is, can insurance companies or life insurance companies use this type of technology and then identify a patient as being too high risk for coverage? So there's good things about data, but there's also dangers about data and this type of predictive analysis.
I think final 2 minutes, maybe I'll take the privilege of asking one specific question to both of you. Assuming you have, I know you are not an early stage investor, and Dr. Sharif is not an investor, but definitely comes from a clinical background. If you have a couple of $1 million, if you want to bet on 1 or 2 startups in healthcare and tech space, what could be that space? Quick answer.
You want real examples or hypothetical examples?
No, what appeals to you and where you feel there
yes,
maybe?
I'll probably talk about categories and not
absolutely.
Not specific companies. But I think if
categories.
For me, I think one area which I've always found fascinating in India is so we've done a lot in the outpatient space. I think the inpatient space, there are a couple of areas which have fascinated me. There are a couple of companies which are trying that, which is become an aggregator for hospitals and become a virtual hospital. I think that really interests me. In the Indian context, I think that's a huge opportunity because, we are at a situation where I think our beds per capita are...
I'm only giving $1 or $2 million.
Yeah. Only a couple $1 million, don't worry. And then we'll go get it from someone else. So, we are in a situation where our beds per capita are significantly higher in metros, and all the tertiary care specialists are completely concentrated in metros. So there is significant domestic tourism available. So for somebody who can actually be the aggregator to tell you, here is the cheapest cost and here is the best quality clinical services available, and a few startups are trying to do that. I think that's a difficult problem to crack, but I would sort of back it. Given that we have only 30 seconds, I'll reserve my second idea.
So again, I'll come back to physician utilization. There's a lot of tasks within healthcare that we do routinely. And if there are technologies that can help and not necessitate the doctor to do those type of things, that's what I would primarily invest in: chest X-rays and reading chest X-rays. But again, with all of this AI and machine learning, it's all about the algorithms, and we've been working on a tool ourselves. At the end of the day, it's a computer, and so how you program it and what you do with it results in the output. And I think that's very important to remember.
Sure. Today, in fact, I was reading some article. If you say CEO, Google image, it shows up as a white man in a suit. And if you say idiot, it shows President Trump actually. So sometimes the algorithms, is it the design of the algorithms or the science behind the algorithms is very important. I think with this, I would like to thank both Sandeep Singh and Dr. Sharif. Sorry we couldn't take more questions. Some of us have to catch our flights. I would like to thank the VC Circle for a fabulous job and audience, I think, sitting all through. In fact, I enjoyed today's the sessions and wish you all the best. Thank you.
Thank you.